anxiety disorder. This is my second video on anxiety disorder. Among the subtypes of anxiety, GAD, that is Generalized Anxiety Disorder, is discussed here. Now, Generalized Anxiety Disorder. GAD or Generalized Anxiety Disorder is a common disorder characterized by long-lasting anxiety which is not focused on any one object or situation. Those with generalized anxiety disorder experience non-specific, persistent fear and worry and become overly concerned with everyday matters. Symptoms or difficulties. In generalized anxiety disorder, symptoms can vary. They may include persistent worrying or anxiety about a number of areas that are out of proportion to the impact of the events. Number 2. Overthinking plans and solutions to all possible worst case outcomes. Number 4. Perceiving situations and events as threatening even when they are not. Number 5. Difficulty handling uncertainty. Number 6. Indecisiveness and fear of making the wrong decision. Number 7. Inability to set aside or set go of a worry. Number 8. Inability to relax, feeling restlessness and feeling keyed up or on edge. Number 9. Difficulty concentrating or the feeling that your mind goes blank. Now, physical signs and symptoms may include fatigue, trouble sleeping, muscle tension or muscle aches, trembling, feeling twitching, nervousness or being easily startled, sweating, nausea, diarrhea or irritable bowel syndrome, irritability, etc. Symptoms in children and teenagers. Children and teenagers may have similar worries to adults but also may have excessive worries about. Number 1. Performance at school or sporting events. Family members' safety, being on time, punctuality, earthquakes, nuclear war or other catastrophic events. A child or teen with excessive worry may feel overly anxious to fit in, being a perfectionist, read or task because they are not perfect the first time, spend excessive time doing homework, lack confidence, strive for approval, require a lot of reassurance about performance, have frequent stomach aches or other physical complaints, avoid going to school or avoid social situations. Generalized anxiety disorder requires a medical diagnosis. The condition has symptoms similar to panic disorder, obsessive compulsive disorder and other types of anxiety. These symptoms include constant worry, restlessness and trouble with concentration. Generalized anxiety disorder is characterized by chronic excessive worry accompanied by 3 or more of the following symptoms, viz. Restlessness, fatigue, concentration problems, irritability, muscle tension and sleep disturbance. Generalized anxiety disorder is the most common anxiety disorder to affect older adults. Anxiety can be a symptom of a medical or substance use disorder problem and medical professionals must be aware of this. A diagnosis of GAD is made when a person has been excessively worried about an everyday problem for 6 months or more. These stress can include family life, work, social life, or their own health. A person may find that they have problems making daily decisions and remembering commitments as a result of lack of concentration and or preoccupation with worry. A symptom can be a strained appearance with increased sweating from the hands, feet and axillae, and they may be tearful, which can suggest depression. Before a diagnosis of anxiety disorder is made, drug-induced anxiety and other medical causes must be ruled out. In children, GAD may be associated with the headaches, restlessness, abdominal pain and heart palpitations, typically begins around 8 to 9 years of age. Severe ongoing anxiety that interferes with daily activities, generalized anxiety disorder, can occur at any age. It is very common. More than 10 million cases per year in India is found. It is treatable by a medical professional. It requires a medical diagnosis, laboratory tests or imaging not required. Chronic GAD can last for years and can be lifelong. Causes of generalized anxiety disorder. As with many mental health conditions, the cause of generalized anxiety disorder likely arises from a complex interaction of biological and environmental factors, which may include number 1, differences in brain chemistry and function, number 2, genetics, number 3, differences in the way threats are perceived, number 4, development and personality. Now, risk factors. Women are diagnosed with generalized anxiety disorder somewhat more often than men are. The following factors may increase the risk of developing generalized anxiety disorders. Number 1, personality. A person whose temperament is timid or negative or who avoids anything dangerous may be more prone to generalized anxiety disorder than others are. Number 2, genetics. Generalized anxiety disorder may run in families. Number 3, experiences. People with generalized anxiety disorder may have a history of significant life changes, traumatic or negative experiences during childhood, or a recent traumatic or negative event. Chronic medical illness or other mental health disorders may increase risk. Treatment of GAD. Treatment consists of therapy, may include counseling and medication such as antidepressants. Now, when to see a doctor for anxiety? Some anxiety is normal, but see your doctor if the following are present. Number 1, you feel like you are worrying too much and it is interfering with your work, relationships and other parts of your life. Number 2, you feel depressed or irritable, have trouble with drinking or drugs, or you have other mental health concerns along with anxiety. Number 3, you have suicidal thoughts or behaviors. Seek emergency treatment immediately.